Hello, I'm Dr. Hanan. I'm a professor of medicine in the section of gastroenterology at the University of Chicago. In the next few minutes, I'm going to talk about irritable bowel syndrome. Irritable bowel syndrome is a chronic condition which is a very frequent condition which brings patients to see a gastroenterologist. Irritable bowel syndrome, or IBS as it's more frequently called, is a chronic condition which may present with symptoms of abdominal pain, discomfort, generally associated with a change in one's bowel habits, such as either constipation, diarrhea, or alternation between constipation and diarrhea. Irritable bowel syndrome should not be confused with another gastrointestinal disorder which has a similar nomenclature called IBD. IBD is the abbreviation which we use for inflammatory bowel disease, which is Crohn's disease or ulcerative colitis. Sometimes patients will confuse these two conditions. It's important to know that irritable bowel syndrome is generally a very benign process and one which usually does not lead to other health disorders or complications. Most patients with irritable bowel syndrome will notice symptoms of abdominal distension, constipation, which is often relieved with diarrhea, but then only to be followed by more constipation. The pain is usually alleviated with improvement of bowel movements. We don't know what causes IBS. There are many theories that there's an interaction between our brain and our intestine in sensing pain or altering the motility, but some also suggest that the change in bacteria flora or the type of bacteria that we have in our intestines, particularly in our colon, may trigger off some of these symptoms. The important things to know in making the diagnosis of irritable bowel syndrome is that certain things are not present in the patient's history. First, it is generally not associated with significant weight loss. Secondly, it is generally not associated with any gastrointestinal bleeding, and laboratory values such as blood counts and blood chemistries are typically normal. The other condition which may mimic symptoms of irritable bowel syndrome is that of celiac disease, particularly in younger patients. Celiac disease is a condition which may give symptoms similar to irritable bowel syndrome, but is typically brought about by eating products that contain gluten. Gluten is a product which is naturally occurring in wheat-containing foods, but is also an additive in many other foods which are commercially available. Gluten sensitivity causes an inflammation of the intestine and hence may give symptoms of abdominal pain, bloating, typically diarrhea, but less frequently constipation. It's important for your physician to distinguish between the three conditions that I've mentioned: irritable bowel syndrome, inflammatory bowel disease, and celiac disease, because the treatment is vastly different among all of these. Sometimes your physician may need to perform certain laboratory tests or may need to do either x-ray tests or endoscopy of either your upper intestinal tract or your colon in order to distinguish between these. But in cases of irritable bowel syndrome, very often history alone can be helpful in distinguishing from the other two illnesses. We don't know what triggers a patient to experience IBS. Sometimes people believe that stress in their daily life may be triggering off irritable bowel symptoms. Introduction of new foods. Certain foods, such as high fiber foods, may cause symptoms of gas and bloating in many patients. Treatment for irritable bowel syndrome is very variable based upon the individual symptoms, but treatment may include alterations in diet, which in many cases can be highly effective and not very restrictive, or it may entail use of certain medications aimed at relieving some of the spasm-like pain that patients may experience with irritable bowel syndrome, and may also include the use of antibiotics, which sometimes may alter the bacteria in our colon, which may be producing some of the symptoms. While gluten does not typically cause symptoms of irritable bowel syndrome, more recently, many studies have suggested that reduction of gluten in the diet may help even if one does not have celiac disease. The important thing to know is that there are many treatment options available, and it is best tailored to an individual patient's symptoms in management of irritable bowel syndrome.